Keyhole surgery, there are many names to the same thing. Some people call it keyhole, some people call it needle hole, some people call it minimally invasive MIS, more commonly known as laparoscopic. They all mean the same thing. Now, the surgery is really the same. If you remove an organ, you remove a tumor, you remove a tumor. But the access into that space is the one that is different. So traditionally, we open up a big wound to gain access to the disease. In keyhole surgery, we can do pretty much the same removal of the disease state with a smaller incision. So when we say keyhole surgery, it's really keyholes surgery. So we typically put about 3 to 4 incisions holes. The smallest is 0.5 cm. The largest is about 1.2 cm on the patient's abdomen. And then we insert our instruments to do the surgery. But a recent branch of keyhole surgery will be single port surgery. Okay, single port surgery, we make one single incision, and with specialized instruments, we can cut out the disease state with just one small hole in the abdomen. Patients who will benefit most will be patients who have a high BMI, who are on the obese or more massive side, because in such patients, to gain access to an organ, the surgical approach or the incision made will be quite formidable. Keyhole surgery allows us to access deep cavities in big-sized patients relatively easy. The second would be patients who are expected or who expects to get back to work fast. Let's take kidney surgery, kidney cancer surgery, for example. The traditional kidney cancer surgery is done with a 20 to 30 centimeter long wound across the abdomen. The patient will have to stay in the hospital for 1 to 2 weeks, and it will not be before a month before the patient can truly go back to the activities of daily living. But with keyhole surgery, instead of 1 week to 2 weeks stay in the hospital, most of my patients leave the hospital after 2 nights. And at the end of the first week, we would see him doing a brisk walk or even a light run. And most patients will go back to work after a week of recuperation. And it has really revolutionized the way we treat cancers especially.